Hi everyone, welcome to our presentation on psychopharmacology and what we as nurses need to know. So what is psychopharmacology? Psychopharmacology is the study of the effects of drugs on affect, cognition, and behavior. These drugs interact with particular target sites or receptors found in the nervous system to induce widespread changes in physiological or psychological functions. The drugs involved in psychopharmacology can be found from natural sources like plants or animals and can be synthesized from artificial sources. Some of the examples of these medications that we'll be talking about include anti-anxiety medications, antidepressants, anticonvulsants, antipsychotics, medications to treat ADHD, and medications to treat Alzheimer's. Psychopharmacology is related to the biological model of mental illness. This model aims at understanding how the body and the brain work together to formulate thoughts, feelings, beliefs, and memories by focusing on chemical, biological, and genetic influences. When an illness or disease is found, the cause of the illness can be targeted using physical interventions, including medications. The revolution of psychopharmacology began in 1950 when chlorpromazine, an antipsychotic medication, was synthesized by a French drug company. This development posed a challenge to the traditional psychodynamic approach of mental illness. The discovery that powerful drugs could relieve patients from psychosis and mania proved to people that the brain plays a huge role in psychiatric illnesses. Since 1950, more medications have been developed that have helped reduce the need for hospitalizations of people suffering from a mental illness, including psychosis, mania, depression, and anxiety. This has led to dramatic improvements in the quality of life of people with a mental illness. The emergence of psychopharmacology led to the decade of the brain in the 1990s. This decade was characterized by widespread research and the study of the structure and function of the brain. Today, psychoactive medications are used to help restore brain function by acting on a selection of neurotransmitters in the brain. This allows patients with mental illnesses to live a life filled with confidence and far less of an emotional burden. This infographic from the National Alliance on Mental Illness illustrates the prevalence of mental illness in our population. As shown, 1 in 5 adults in America experience mental illness in a given year, and nearly 1 in 25 live with a serious mental illness. With millions affected by anxiety, major depression, bipolar disorder, and schizophrenia, among other mental illness diagnoses, it is critical for nurses to understand psychopharmacological treatment in order to provide appropriate and effective care. So, the importance of psychopharmacology for nurses. Nurses play a significant role in the psychopharmacologic treatment of patients. Not only are nurses responsible for the preparation and administration of the psychopharmacologic medications, they also educate patients on the drug, monitor the patient as to whether the drug is having the desired effects, and monitor the patient to determine if he or she is having adverse drug effects. Nurses also make determinations regarding PRN medication administration. During each encounter with the patient, nurses engage in therapeutic interpersonal interactions, build rapport work with the patient to develop health goals, and implement interventions which, along with the psychopharmacologic treatment, facilitate achievement of mutually desired agreed-upon goals. Similar to how it is applied in other nursing disciplines, the goal of nursing process in psychopharmacologic treatment is to provide individualized, patient-centered, goal-oriented action, which facilitates health promotion. As you know, the nursing process is comprised of 5 stages: assessment, diagnosis, planning, implementation, and evaluation. During the assessment phase, nurses should do a full physical exam, mental status exam, take the vital signs, and document any other relevant critical information. Nurses are constantly performing ongoing assessments to further explore behavior in order to better understand the context under which a behavior took place and what the patient was thinking or feeling when they had the behavior. During the diagnosis phase, nurses identify maladaptive behaviors based on the observations made in the assessment phase. The nursing diagnosis is based off the patient's verbalizations and behaviors. In the planning phase, the nurse and patient develop mutually agreed upon goals and interventions. Nurses prioritize nursing goals and interventions based on the patient's needs and behaviors. For example, if the patient is exhibiting suicidal ideations, homicidal ideations, or destructive behaviors, the intervention for the emergency behavior would become a priority. It is also important to identify short-term goals as well as long-term goals. During the implementation phase, nurses implement the care plan. This can include medication administration, monitoring vitals, observing patient behavior, providing education, and encouraging the patient to attend therapeutic activities. In the implementation phase, nurses utilize both their medication administration skills, health assessment skills, and therapeutic interpersonal interaction skills. Anti-anxiety and hypnotic medications. Patients experiencing anxiety are first usually encouraged to explore and develop coping strategies such as meditation, cognitive behavioral therapy, or counseling. If anxiety becomes severe enough to interfere with daily activity, pharmacotherapy is indicated. Anti-anxiety and hypnotic medications typically act on gamma-aminobutyric acid, or GABA, the major inhibitory neurotransmitter in the central nervous system. Of the three major types of GABA receptors, drugs that enhance GABA-A are associated with producing a sedative hypnotic effect on the brain function and causing CNS depression. The therapeutic effects of these medications include relief from anxiety symptoms and reduced frequency of interrupted sleep. The main point of concern in the use of these medications is CNS depression. Patients should be monitored closely for symptoms such as confusion, mood swings, lethargy, respiratory depression, significant drowsiness, or sedation. Concurrent use with alcohol or CNS depressants produces an additive effect and can increase risk of coma or death. Benzodiazepines are the preferred drugs for anxiety disorders and insomnia and include commonly heard medications such as Valium, Klonopin, and Xanax. These drugs act by binding GABA to receptor chloride channel molecules to intensify inhibitory effect of GABA, which also makes them effective as anticonvulsants and in calming the neuronal overexcitement of alcohol withdrawal. The major advantage of benzodiazepines is that when they are used alone, they will rarely produce CNS depression to the point that life-threatening respiratory depression, coma, or death result, even in excessive amounts. However, concurrent use with other CNS depressants such as alcohol or opiates can have life-threatening effects. The most common side effects are sedation and drowsiness. The drug can also interfere with motor ability, attention, and judgment, so patients should be warned about fall risk in engaging in activities that require concentration and reflexive capability, such as driving or operating machinery. At high doses or when administered via IV, more serious side effects include amnesia, disorientation, sleep disturbances, vision changes, and nausea and vomiting. In addition, the drug is indicated for short-term use between 2 to 4 weeks, and long-term use has been associated with tolerance, dependence, and addiction. Another anti-anxiety option is bupropion, which reduces anxiety without strong sedative hypnotic effects such as drowsiness or sedation, making them much better tolerated than benzodiazepines. The mechanism of action is not well understood, but it may act as a partial serotonin agonist. Since bupropion does not act on GABA receptors, there is no risk of CNS depression or potential for addiction as there is with benzodiazepines. Adverse effects include dizziness and insomnia. Sedative hypnotic sleep agents such as Ambien and Lunesta are indicated for treatment of insomnia and help to reduce the time it takes to fall asleep and decrease sleep interruptions. Although they also act on GABA receptors, they produce sedative effects without the anti-anxiety or muscle relaxant effects of benzodiazepines. These drugs have quick onset of reaction, and patients should be advised to take them right before going to bed. The duration of action is also very short, with Lunesta having the longest effect of an average 7 to 8 hours of sleep per dose. Adverse effects include daytime sedation, confusion, dizziness, nausea, vomiting, amnesia, and ataxia. Depression is associated with an imbalance of the neurotransmitters norepinephrine and serotonin in regions of the brain related to focus, cognition, and emotion. These neurotransmitters play a major role in regulating mood, and an imbalance or transmission deficiency results in the persistent feelings of sadness and loss of interest which characterizes depression. Antidepressants treat depression by increasing the synaptic levels of norepinephrine, serotonin, and therefore enhancing mood. Tricyclic antidepressants act primarily by inhibiting reuptake of these two neurotransmitters. The most common side effects are orthostatic hypotension, sedation. Since these drugs also block muscarinic receptors, it also produces adverse anticholinergic effects such as dry mouth, blurred vision, urinary dysfunction, constipation, and tachycardia, which can be problematic for patient compliance. It should be noted that TCAs have a long half-life, and more severe effects can occur if they accumulate in cardiac tissue. Overdose can be fatal and result of disruption of normal heart conduction. Selective serotonin reuptake inhibitors slow the reuptake of serotonin into presynaptic nerve terminals. They are often the drug of choice due to a more favorable side effect profile. Due to the more selective action, sedation is less frequent and anticholinergic effects such as seen with TCAs are less common. As with most antidepressants, it may take 2 to 4 weeks before beneficial effects are apparent, though side effects will manifest before then. Adverse effects include sexual dysfunction, nausea, nervousness, anxiety, weight gain, and insomnia. Serious withdrawal symptoms can occur if treatment is stopped abruptly, and doses should be slowly adjusted over time. MAO inhibitors increase levels of norepinephrine and serotonin by preventing degradation by MAO enzyme. This enzyme is located in the neurons and the liver and is responsible for degradation of any monoamine neurotransmitters or substances. Although inhibiting MAO is beneficial in enhancing mood, it also impairs the body's ability to break down monoamines that enter the body through food. A main concern of this is tyramine, which is found in foods such as aged cheese, smoked or pickled fish, and wine. If tyramine enters the bloodstream in high concentrations, it can cause significant vasoconstriction, resulting in hypertensive crisis. MAO inhibitors also interact dangerously with a number of other medications, including TCAs and SSRIs, leading to toxicity and serotonin syndrome, which can be life-threatening. Other adverse effects include orthostatic hypotension, headache, and insomnia. Due to the risk of interactions, MAO inhibitors have a low safety margin and are generally reserved for patients who did not respond to other treatment options. Serotonin norepinephrine reuptake inhibitors, as the name infers, block the reuptake of these neurotransmitters. Hypertension is a risk at high doses and can increase diastolic blood pressure by 7 to 10 millimeters per mercury. Among the SNRIs, Cymbalta is also indicated for diabetic peripheral neuropathy and fibromyalgia in addition to depression. Neuropathic pain signals ascending to the brain are limited by the activation of descending norepinephrine to the spinal cord. Mood stabilizers are prescribed as treatment for bipolar disorder and have the ability to moderate the extreme shifts in emotion by stabilizing mood during periods of mania and acting as an antidepressant during periods of depression. Lithium is the primary mood stabilizer and works by altering ionic activity and the activity of neurons containing dopamine, norepinephrine, and serotonin. It may take 5 to 7 days for the therapeutic effects to appear, with a peak of action between 10 to 21 days. Lithium has a very narrow therapeutic index with a high risk for toxicity. Patients should be monitored closely and assessed frequently as toxicity is closely related to serum concentration. Acute overdose is characterized by convulsions and extreme motor dysfunction and may be treated by hemodialysis. Sodium depletion can reduce lithium excretion and increase risk for toxicity, so salt-free diet should be avoided. Since lithium is a positively charged ion and affects electrical conductivity, all body functions regulated by electrical currents are at risk for convulsions at high doses. Adverse effects include dizziness, fatigue, short-term memory loss, weight gain, increased urination, nausea, vomiting, loss of appetite, diarrhea, muscular weakness, and slight tremors. The general indications for this type of drug are to decrease the frequency of seizures and help mood disorders such as bipolar disorder. According to our textbook, the mechanism of action for anticonvulsants involves the alternation of electrical conductivity in membranes. In particular, they reduce the firing rate of very high-frequency neurons in the brain. This recalibration of the brain can also help people who are diagnosed with bipolar disorder. The nursing implications of anticonvulsants include assessments and toxicity monitoring. The assessments that should be centered around frequency, location, and characteristics of seizures. It is important to continually check the serum levels of the patient while they are on this type of medication to ensure they are not reaching a toxic level. This is especially important if the physician has ordered another type of anticonvulsant to the orders or dosage is changing drastically. Finally, one aspect of patient education includes directing the patient to take the medication exactly as prescribed by the physician. Missing or skipping doses as well as abruptly stopping the medication can cause adverse reactions. Also advise your patient that this medication can cause dizziness, so it's advisable not to drive or operate machinery before the patient knows if they will be affected by this. Another important piece of information is to avoid other CNS depressants such as alcohol, as this can cause adverse effects. One example of anticonvulsants is valproate, also known as Depakote. It is mainly used to treat bipolar disorder. The common adverse reactions include tremors, weight gain, and sedation. More serious side effects are thrombocytopenia, hepatic failure, birth defects, and pancreatitis. Another example of an anticonvulsant medication is called carbamazepine and is primarily used in treatment of manic episodes. Adverse effects of this medication include dry mouth, urinary retention, sedation, and ataxia. Although a rash only happens in a small population of people taking this medication, it should be looked at by a doctor as soon as possible because it can evolve into a more serious condition known as Stevens-Johnson syndrome. The last example of an anticonvulsant medication is lamotrigine. It can treat depression and is also prescribed to treat bipolar disorder, but it cannot help a person who is having a manic episode. It's more of a medication to be taken on a regular basis. The most serious adverse reaction with this medication is a rash. However, it could be reported to your doctor immediately because it can evolve into Stevens-Johnson syndrome. Antipsychotics. Predominantly, antipsychotics are used to treat schizophrenia. The mechanism of action for antipsychotics is to block dopamine receptors, which alters the flow of dopamine in the brain. This mechanism can help a person who has been diagnosed with schizophrenia, which is a disease that has been linked to overactive dopamine in the brain. The nursing implications of anticonvulsants include assessment of various systems before and after administration of the medication. For example, it's important to know the patient's mental status, which includes mood and behavior before administration. It's also important to get the patient's blood pressure to make sure there are no adverse reactions to the medication. It is also important to ensure that the patient takes their medication appropriately, and in order to do this, you may need to observe the patient take the medication and make sure they swallow it. The final assessment is to monitor your patient for any particular adverse effects such as continuous movement, trouble swallowing, loss of balance, fever, respiratory difficulties, and severe muscle stiffness. Patient education is incredibly important. The first vital piece of information to give your patient is to have them change position slowly to decrease risk of orthostatic hypotension, which can lead to risk for falls. It is also important to instruct your patient to wear sunscreen and appropriate clothing to decrease a chance of having photosensitivities. Finally, using frequent mouthwashes and ensuring good oral hygiene can help decrease the incidence of dry mouth a patient might experience. One example of an antipsychotic is clozapine, which is a second-generation antipsychotic. It is mainly used to treat schizophrenia. The common adverse reactions include dizziness, sedation, weight gain, hyperglycemia, nausea, vomiting, and dry mouth. It can cause more serious side effects such as DVT. Another example of antipsychotic medication is risperidone. It is used to treat patients who are diagnosed with schizophrenia between the ages of 13 and 17 and bipolar disorder 1 in patients 10 to 17 years old. The adverse effects that can occur while taking this medication is aggressive behavior, dizziness, headache, insomnia, visual disturbances, back pain, and difficulty urinating. In some severe cases, it can lead to suicidal ideation. The last example is called Seroquel, and it treats schizophrenic patients and depressive episodes in bipolar disorder. Some adverse reactions of this medication include seizures, ear pain, pancreatitis, palpitations, weight gain, lowered hemoglobin, and flu-like symptoms. Medications to treat ADHD. Symptoms of ADHD include short attention span, impulsivity, and overactivity. The primary type of medication that is used to treat ADHD are psychostimulant drugs. There are two main types of psychostimulant drugs, the first being methylphenidates, which include Ritalin and Daytrana, and dexoamphetamines, which include Adderall and Vyvanase. Adverse effects from these medications include hypertension, agitation, weight loss from decreased appetite, fatigue, dizziness, and stunted growth. Medications to treat Alzheimer's disease. Symptoms of Alzheimer's include progressive loss of memory, along with other higher brain function as the disease progresses. One class of medication is called the acetylcholinesterase inhibitors, which can slow memory loss and improve memory in some patients. These medications work to inactivate the breakdown of acetylcholine, which causes a higher concentration in the brain, which helps improve memory. Glutamate is a neurotransmitter in the brain that, if it's overexcited, can cause damage to the neurons in the brain. Namenda and Namenda extended release can help get rid of any excess glutamate in the brain to help it function better. Medications like Namenda can have adverse effects such as dizziness, diarrhea, hypertension, urinary frequency, and anemia. Some special considerations in psychopharmacology. Special considerations nurses need to be aware of with the geriatric population include increased sensitivity to drugs and an increased risk of drug toxicity. This could be due to normal aging or decreased renal or liver function. It is important for nurses to monitor patients for serious adverse effects and signs of drug toxicity. Special considerations for pediatrics include being aware that, similar to other drugs, pediatrics follow a weight-based dosing scale for many of the psychopharmacological drugs. Nurses must also consider the addictive potential of certain psychopharmacological drugs and be sure to explain this information to the patient. Finally, it's important that nurses are aware that the best results in treating mental illnesses include a combination of psychopharmacology and different forms of therapy. So, legal and ethical issues. There are many legal and ethical concerns surrounding psychopharmacology. One of these concerns is for the safety and long-term side effects in children who take psychopharmacological drugs. This is due to the possible effects that the drugs can have on their developing brains. This is also an ethical question over the non-prescription use of ADHD medications by healthy individuals. The problem is that people who are not diagnosed with ADHD take ADHD medication as a way to enhance their cognitive performance and concentration. Some consider this practice a form of cheating. So, thank you all for listening. And just to summarize everything, it is important to know that there are many different kinds of psychopharmacological medications available, but as nurses, we need to have effective relationships with our patients in order to best serve them wherever they are in their treatment plan. Thank you for listening.